Thank you. Good afternoon or good morning, depending on where you are in the country. My name is Julie Poppy, and I'm with the Early Care and Education project at NCSL, and I thank everyone for being on the webinar call supporting children's social and emotional needs and reducing early childhood expulsions. Today we have current fellows as well as alumni from the last 2 years of the program, as well as legislators and other partners from throughout the country on the call today. We have almost 100 participants from over 25 states on the call, so this is great. We also have our project staff here, Robin Lipquist and Allison May, and also Rebecca. So today's webinar will focus on how state legislatures can approach the current concerns with young children's challenging behavior and recent expulsion data in early childhood settings. You're going to hear the latest research on social emotional competence and examples of work being done in states to address the range of social emotional needs for young children. You're going to learn the effective intervention approaches for children and critical components for supporting teachers and parents. Finally, you're going to hear about some states that have legislatively tackled this issue and are trying to reduce the number of suspensions in preschool programs. So hopefully we're going to provide you with some options for your legislative toolkit. We know that some of you may be participating via the phone and not on the webinar platform, so we appreciate your ability to join in and listen. An archived copy of the webinar will be available and posted to NCSL's website shortly, and we'll notify all registrants via email once it's posted. For our current 4th round of Early Learning Fellows, this webinar culminates your time as a current fellow, and you will now become a member of the alumni group. As an alumni, NCSL staff is here to assist you in your state as you think through policy options for children and families. As an alumni, you will also be added to our alumni listserv, and you'll continue to receive pertinent information and timely invitations. So you're joining our network now of over 100 past NCSL Early Learning Fellows, so we're really excited of this group. So our goals for the next hour is to make this presentation as interactive as possible. Should you have any questions, please note you may type them in the chat box as previously mentioned by our operator. We're going to aim to answer as many questions as possible during this call, but know that we might not be able to get to all of them. So please feel free to email NCSL after this one, so we're going to have to, unfortunately, end our call 5 minutes early. And again, if there are any questions that are unanswered, feel free to email NCSL staff. So before I turn it over to our first presenter, I want to give you a few. Phil Strain is a professor of educational psychology and early childhood and the director of the Positive Early Learning Experiences Center at the University of Colorado, Denver. Mr. Strain is the author of over 300 scientific papers in early intervention and a principal investigator of federal research and technical assistance grants totaling over $50 million. His current work is focused on young children with autism, prevention of challenging behaviors, and working on scaling up and sustaining evidence-based practices in early childhood settings. I'm going to introduce our second speaker, who is Council Member Charles Allen. He's a member of the DC Council for close to 1 year and represents Ward 6. He's worked on school reform, working with small businesses, and improving his community. Councilmember Allen is a member of DC Council's Committee on Education, Transportation and Environment, Business, Consumer, and Regulatory Affairs. He serves on the Metropolitan Washington Council of Governments Transportation Planning Board. He is an NCSL Early Learning Fellow, and he also serves as on NCSL's Standing Committee on Education, Natural Resources and Infrastructure, Law and Criminal Justice, and Public Safety. Councilmember Allen will talk we'll talk more about the legislation that they're doing in D.C. that's trying to legislatively tackle and reduce the number of suspensions in pre-kindergarten programs. And with that, I'm going to hand it over now to our first presenter, Phil, who's going to give us some of the latest statistics, research, and strategies on supporting children's social and emotional needs and addressing early childhood expulsions. The floor is yours, Phil. The floor is yours.
Well, I'll take both, actually.
You'll take both. Great. Thank you.
So first of all, thanks to NCSL for this opportunity, and a sincere thank you to all of you who've devoted this time this afternoon to discuss a topic of such fundamental importance to young children and their families. I'd like to begin by quoting, I think, probably the most influential child psychologist of the last decade, the great Nicholas Hobbs. And he was speaking about the intersection of children with challenging behavior, parenting practices, poverty, and existing service delivery in 1965. He said the following. This was actually in a freshman psychology class, and I wrote it down in my brown spiral notebook. And he said the way one defines a problem will determine in large measure the strategies used to solve it. I guess at some level that's intuitively obvious and simple-minded, but in practice it can be enormously complex. And I'd like to focus most of my comments today on a careful and complete identification of the problem. And I'd like to start first by thinking about the problem at a front page headline level. So what are the real headlines around expulsion? Expulsion and suspension. Well, we know from recent national databases that the rate of expulsion and suspension across states is anywhere from 3 to 34 times the rate of expulsion and suspension as observed in K-12. And that doesn't include what I like to call soft suspension and expulsion. These are more surreptitious actions, but they are just as detrimental to children and families. Soft suspension includes things like the call at 11:30 to the single mom at her work site saying, you know, Phil, bit little Heather once again today. You're just going to have to come get her. That's a suspension. Sometimes soft suspension and expulsion comes in the form of a conversation with that same person, and the gist of the conversation might follow it like this. You know, we really are not sure that your child is ready for a full-day daycare program. We think they might be best served by coming here just 2 hours. If you think about the database and how we collect it now, and the lack of a database on soft suspension and expulsion, I hope we can agree that very likely in all probability, we're looking at a gross underestimation of the problem. The second headline that we know from the database is that there is horrific disproportionality in the occurrence of expulsion and suspension with black males, with American Indian, Native Alaskan, and Hispanic children being disproportionately represented in who experiences these kinds of disinvitations to participate. Unfortunately, we also know from behavioral research on this kind of practice that removals in almost all cases will result in an exacerbation of child challenging behavior. And we have this data because actually the greatest number of suspensions and expulsions are repeat suspensions and expulsions. If this were an efficacious practice, we wouldn't be seeing these kinds of repeat episodes. We also know that there is significant fallout to families, fallout emotionally, fallout financially, because early care and education is the jobs program for most families. And there's fallout related to connectedness with human service delivery. And connectedness sometimes gets misinterpreted as some sort of fuzzy hippie concept from the 60s, but it's a real phenomenon. And the connectedness that family members feel toward helping institutions, be they early care and education or later on K-12, has a powerful influence on children's ultimate academic success and lifetime outcomes. And finally, looking at this problem from a headline standpoint, and to state the obvious, if you're not there, if you're not in early care and education, there's no way to reap the benefits of those forms of service delivery. Well, that's one look . Well, that's one look at the problem. But I'd like us to skip over the headlines for a moment and go to page 8 and look in more detail. And I'd have you consider the possibility that this slide, this first slide, really represents a set of symptoms of some underlying fundamental issues. Well, what are they? Well, we actually have some data to explain the phenomena around expulsion and suspension. And for each of these kind of elements, if you will, or possible explanations, I've tried to designate where there is a lot of scientific evidence, including some direct experimental studies, where there is a small amount of evidence, and where there is something in between, a medium evidence base. So just to quickly review these, children's challenging behavior are the product of a skill deficit, although admittedly, in many cases, it doesn't look or feel like that. Sometimes to providers, it looks and feels like willful disobedience and noncompliance. But we actually have a wealth of data, and I think no data that contraindicates the fact that until proven otherwise, we should assume that when children engage in challenging behavior, it's the product of a skill deficit. Now, it's also true that with some children in early care and education programs, and this is particularly related to children in Head Start, there is a small amount of evidence that challenging behavior in young children may well be a product of mental health issues, particularly those that we know derive from exposure to violence, particularly the observation of violence in neighborhoods. We also have evidence that a part of this problem are early care and education systems that are stretched too thin. The ratios of adults to children don't allow for adequate supervision. The length of the day is, I'm not talking about the length of the day for children, but the length of the day for providers is too great. And the number of dollars, particularly dollars devoted to ongoing support and coaching around evidence-based practices, are insufficient. We have a moderate amount of evidence, and I think probably over the next couple of years, I would reserve the right to change this to a lot of evidence, because what we're seeing is a significant correlation between programs that are stretched too thin and high levels of expulsion and suspension. We also know, and we've known this for 20 years really, 25 perhaps, that a large piece of this problem lie in adult skill deficits, and specifically I'm referring to providers in early care and education settings. We have strong experimental evidence replicated across years, replicated across multiple investigators, that suggest that when providers in these settings are offered practice-based coaching that improve their skills around teaching social and emotional skills to children, not only do child development differences appear in short order, but they persist over time, and that expulsion and suspension is dramatically reduced. Now, for some adults in these settings, we also know that part of the problem is that they are experiencing mental health and particularly stress-related issues. And accordingly, we need to consider this in terms of a full package of intervention to solve the larger problems, the headline problems. We also have a moderate amount of evidence from correlational studies across states showing that in states that actually have more, if you will, permissiveness around allowing providers to engage in disinviting children and families from early care and education, they in fact, logically, I would think, have higher rates of expulsion and suspension. Finally, I'd like to suggest to you that the largest amount of evidence that we have we have is that there's some combination of all of the above at play. So there is some good news. Actually, there's some really good news. And I want to share with you just one example of Colorado's work to reduce the expulsion from publicly funded child care. As it turns out, in 2006, the Colorado Legislature, actually in 2005 this started, had on its radar screen for a variety of reasons that there was a spike in the number of children being removed from early care and education settings. They commissioned a study that myself and colleagues participated in. And what we found was in 2006, the base rate was for expulsions was 10 in 1,000. Now, this was a large survey that looked at all kinds of variables associated with expulsion. One of the things that we asked directly of providers is, well, how did you respond to children's challenging behavior? When we asked that question, we found something very disturbing. Beyond the 10 in 1,000 rate, we found that there was a 4% probability that people were actually using an evidence-based practice to address challenging behavior. Now, that resulted in the year 2008, the cross-agency funding of the Pyramid Plus Center, the Colorado Center on Social Emotional Development and Inclusion, which I'll talk about in a bit more depth in a moment. But in 2011, we surveyed the same providers and found that the rate of expulsion had been significantly reduced. We were happy with that, but not happy that there was still 4 in 1,000. That is still unacceptable, wholly unacceptable. But we also noticed that there was almost a fourfold, a little bit more than a fourfold increase in providers' use of evidence-based practice as their first line of response to children's challenging behavior. So what was that multi-level assault on the problem of suspension and expulsion? Well, it had a number of components, which I'll just highlight very briefly. It started with the establishment of a cross-sector state team composed of leaders at the highest level of government that we could muster, in child care, in Head Start, in public pre-K, early childhood special education, mental health, child welfare, higher education. And they had a number of objectives, but their primary one was to actually build a professional development system around around a set of evidence-based practices, in this case, the pyramid model. And some of the things that they accomplished was the creation of a career ladder with the rungs on that ladder representing increased fidelity of use of evidence-based practices. We were also able to incorporate elements of prevention and intervention around young children's challenging behavior into quality rating and improvement system. Director requirements for child care were modified to include specific training in the pyramid content. I can report now that I believe every public education higher ed institution in Colorado now uses pyramid model materials in their coursework. They developed a common language across all of these agencies and a common training. Essentially what they did is they pooled their admittedly limited resources within each agency and found adequate resources to address the problem. The other thing that we did is we set up model centers around the state that agreed immediately to zero reject. That is, children were not removed from settings regardless of the nature of their behavior or the repetitiveness of it. These centers were provided with extensive training and technical assistance, and in turn, we held them to a very high standard of fidelity of practices as well as outcome data. And after 2 years, 80% fidelity in practice use was demonstrated, and we're happy to report that looking at changes in the percent of children falling into a social emotional risk category, a 70% reduction from fall to spring. Another key component of this model, and any effective model is going to be the establishment of a coaching network, because we know something about adult behavior change and human service delivery, and that it absolutely requires practice-based coaching to get there. And so the center has certified now 60 coaches across the state in a rigorous program that demands that the coaches turn in videotapes of themselves coaching their coachees, and the coachees have to demonstrate behavior change, and indeed the next step is necessary to the children that those coachees interact with have to demonstrate behavior change. So we complete the cycle, if you will, in this certification process. The other thing that happened across these agencies is that they adopted an evidence-based approach to prevention and intervention, but they also did something else that's equally important. They eliminated state support for non-evidence-based practices, practices that people enjoyed going to training about, admittedly, but where there was very little, if any, evidence for the efficacy of what was being done. Another thing that I should point out happened as a result of this process process, and that was of fundamental importance. That was an expansion of early childhood mental health consultants, but just as important, an expansion of what they could bill for, which previously had been limited to individual cases, but now they were allowed to bill for professional development directed to single or, in most cases, groups of early care and education providers. And more recently, in the last several years, we've been able to take these model centers to scale with dollars that have gone to early childhood community councils throughout the state of Colorado. If I could go back for just a moment. Just to wrap up quickly, well, what is this pyramid model? There's nothing particularly magic about it. It is a tiered system of support, which is based upon the notion that we have to establish, first and foremost, an effective early care and education workforce that requires systems and policies and legislative supports to underpin that effective workforce. And then for children and families, the pyramid model emphasizes for all nurturing and responsive relationships, high quality supportive environments. For a smaller number of children, very targeted, focused teaching strategies to increase the likelihood of children engaging in self-regulatory behaviors, in calming down steps, in making friends. And then for 3, maybe 4% of the population, very intensive interventions to address children's challenging behavior. And just to conclude, if you'd like to address any questions, to me, that's my best contact information. If you want information specific to the specific elements, the rungs in the pyramid model, I invite you to go to the CEPHL website. If you're interested in how we've rolled this out in a systems framework across states, that information is available on challengingbehavior.org website. And if people are specifically interested in actual training related to pyramid practices, that information is available on pyramidmodel.org.
Thanks so much, Phil. Before I go on to Council Member Allen, we did get a few questions that I'd like to address right now. A question came in about regarding Colorado. What is the difference between the 60 coaches that you mentioned and the early childhood mental health consultants?
That's a great question. There is some overlap. I can tell you that most, if not all now, the early childhood mental health consultants have been trained in the pyramid model, and some fraction of those folks are coaches. The work of the coaches per se is more broad, if you will, and so the coaches are are equipped not just to address issues that may arise around individual child care centers or preschool programs and improving adult performance in that regard, but they also have competencies around building brand new model sites. So they have a bit larger, if you will, job description.
Thanks, Phil. And then there was a follow-up question about how can we learn more about the funding streams that were pulled together and how they work to produce these strategies?
Well, I would be glad to if someone wants to contact me directly. Mm-hmm. Most of the initial funding came from child care. Additional support came from mental health. Additional support has come from Colorado Department of Education. Subsequently, after that initial public investment, a number of private not-for-profit agencies have contributed dollars, and so it's the ongoing program has multiple sources of support, public and private dollars.
Okay. And then there was a follow-up question regarding, I do believe, the billing of the early childhood mental health consultants to professional development.
Right.
This person's wanting to know, actually a legislator, Representative Sarah Buxton, is wanting to know if there's sample legislation that expands payment or reimbursement.
I'm trying to think about what the best source of that is. If she would contact me directly, I'll be more than happy to track that down. I don't recall at the moment what it actually took. I'm not sure it was a legislative fix that had to occur. But I can get the details on that. Be
Sure.
happy to.
That's great. And just to follow up, we provided the Colorado resource on the webinar's resource page. It's their latest report, sort of following through now in 2015 the work that's being done in this area. And like I said, that's a resource that's on the webinar webpage. So thank you so much, Phil. I'm going to turn it over now to Council Member Allen. So if you could begin your presentation, that would be great.
All right, thank you, Julie, and hello, everybody.
Hello.
Excellent. All right, so I'm Councilmember Charles Allen here in the District of Columbia, and I guess a spoiler alert, I'll go ahead and start the story by telling you how it ends. And that is that we passed legislation called the Pre-K Student Discipline Amendment Act of 2015, and what it does is it prohibits the suspension and expulsion of a student of pre-kindergarten age from any of our publicly funded pre-K programs. Along with those prohibitions, it also established new annual reporting requirements on suspensions and expulsion data for all grades, and that's for all of our programs, for both of our traditional DC public school system as well as each of our charter schools, so it'll be all of our LEAs. What also noted is introduced by our Education Committee Chair, David Grosso, as well as many of the other council members, and I listed those below as well. And what it does, the legislation itself actually built upon a law that was passed 2 years ago by the same council, which required our state superintendent to begin collecting data and to examine the out-of-school suspensions and expulsions in all of our LEAs and then produce a report. So the legislation was really the next step from really that intense data collection piece, because we knew by anecdote what the problem was, but we really had not collected the data to really help tell us exactly what it was, as well as to help figure out and start developing different solutions. So the first thing I wanted to walk you through is diagnosing the problem. And Phil went through in great detail kind of the issues around what those problems are. I'll go through some of those. I'll try to move through quickly if it's redundant, but also part of it will be telling you the specific story in the District of Columbia. Now, the pre-kindergarten suspensions, as we know, they often result actually from very age-appropriate behaviors or the actions of those adults. And what we found was that many pre-kindergarten students were suspended for what would be described as temper tantrums, for classroom disruption, repeated vulgarities, bathroom mishap, repeated tardiness, dress code violation. Obviously, a 3-year-old is not necessarily going to be responsible for getting themselves to school or what they're picking up to wear. So some of these things are certainly related to the adults and the caregivers. By way of anecdote, we had 181 students in our pre-K 3 and 4, so our 3 and 4-year-olds that were suspended in the previous year. Now, that's not a huge number compared to the totality of enrollment. We have 12,426 students that are enrolled in pre-K in the District of Columbia. That's out of a total of 14,000 students are eligible. So just to have everybody give a little context, nearly 75% of all of our 3-year-olds in DC are in our pre-K 3 program, and 99% of our 4-year-olds are in a pre-K 4. And then obviously as they move to kindergarten, that's when it becomes compulsory. But still, 181 students being suspended is a problem, and we know from experience and from the research that those 181 students, what happens to them is they continue to move through their schooling because of those early suspensions. Part of that is really related to, this is part of why we tried to tackle this, is understanding the school-to-prison pipeline, as we call it. And part of that, as we explore this fairly deeply, we can turn the clock back and see where a lot of these things began. Certainly in 1994, the discipline in the school setting began to change when we had the Gun-Free Schools Act, and we started moving more and more to a complete zero-tolerance discipline policy. And I think we've all seen the headlines about the student who's expelled from school because they had a pair of scissors or had something in their locker. So the zero-tolerance policies that we put in place in the name of trying to make sure everyone was safe, in many cases didn't have a lot of the nuance or the understanding to actually create a safe space, as well as who was being suspended. In many school districts, of course, employed the discipline. It pushed students into the criminal justice system, and that's what we call the school-to-prison pipeline. And these blanket penalties really just continue to increase the suspension rate and do so dramatically. Now, when we think about it from the pre-K perspective, at least part of what helped drive us again in the district was that suspensions were disproportionately targeting the students who need preschool the most. I don't normally like to read quotes that are on a PowerPoint, but I know there's some people just joining by phone, so I'll read this, which is attributed to Walter Gilliam, who's the director in child development social policy at Yale. And he said, if you have a preschool program and you expel the children who need it the most, you're sabotaging your rate of return. No child is more in need of school readiness boosting preschool experience than a child who is being expelled or suspended from preschool. We would never send a child home because the child's struggling in reading. We would never send a child home if that child was struggling with math. Why would we send a child home for struggling with socio-emotional skills? So I kind of boil that down to essentially that we are absolutely undermining our own investment in early childhood education if we have bad suspension and expulsion policies. And to dig into the data a little bit on this to help drive home that point, within the data that was collected in DC on our suspension policies, for a child who was homeless at some point in the previous year, they were more than twice as likely to be suspended. For a child who is who's in a family that's eligible for TANF or SNAP, more than 50% more likely to have had a suspension. For a child who's in the welfare system, more than twice as likely to have been suspended. And at the end of the day, those are exactly the children that we are trying to reach with effective pre-K 3 and 4-year-old programming. But in addition to not targeting the children that are, I think, in most in need of the early childhood education, what we've also found by collecting greater data is that our preschool suspensions disproportionately affect children of color and boys. And Phil talked about this from the global perspective. I'll share with you what the DC data is on this. And that is that African American children represent 18% of preschool enrollment, but represent 48% of preschool children receiving more than one out-of-school suspension. Boys represent 82% of preschool children suspended multiple times, although they represent just 54% of the enrollment. So you can see a really significant skewing and a disproportionate impact of who is being impacted by these suspension policies. So that then took us to how do we go about coming up with a solution. By no means is the district alone. Plenty of other jurisdictions have taken a look at this and have also taken action, and I list just a few here. Every place from the state of New Jersey, Washington, Apple Schools, Baltimore Public Schools, state of California, Chicago, Commonwealth of Massachusetts. So a lot of places have started taking action on this. Now, one of the things that's important to mention, I think, is that of the 181 pre-K suspensions that I mentioned earlier, only 3 of those actually came from our DC public school system, the traditional public schools. So that underscores a significant part of why having the charter system be included and being involved in this is so important, and that we need to have them partner for part of the solutions. Now, one of the things that we certainly had as we introduced legislation on this was we had pushback from the charter school community. So part of this is certainly our conversation with my fellow legislators about how you tackle this and how you work with a lot of different stakeholders. The first piece was that the charter school board testified that they do focus on transparency and information sharing to reduce suspensions and expulsions in the charters, and they don't want to see or did not want to see a mandate or a requirement. And they tried to illustrate the different steps they've taken from the board's perspective to help regulate and share information. And then they specifically asked for the council not to pass the legislation, to delay it for a year. In their testimony, they essentially said, we want you to delay it for a year so we can show you even more progress that we can make, which was really part of them saying, we don't want you to pass this. And their arguments, of course, were around autonomy and that they don't like any legislator passing rules and regulations upon them. And they feel that undermines their whole point around having that chartering authority. So they continue to ask us to work with the Public Charter School Board to find more resources and to find other solutions. And that was significant information that pulled in, and we continue to work with the charter school leaders as well as the Charter School Board itself to think through the legislation as we move it forward. Now I think because we all enjoy making the sausage, part of this is I wanted to talk a little about what were the compromises and what changed from the introduced version of the legislation and what we learned as we went through the public process and did more research to what was ultimately passed. The first thing is how we define suspension. And Phil kind of talked a little bit about this, and we can certainly answer more in questions, but the introduced version of the legislation, suspension was defined as the removal of a student from class attendance or school attendance for a specified period of time. And we heard from LEAs, from advocates, and from others, that was just too broad of a definition. And it would prevent a school from being able to, for example, send a student home if they needed to de-escalate a situation. It would also restrict their ability to use different approaches of just having a student move to a different classroom, be able to move into a therapeutic setting because of the way that we had initially defined that. So that's one of the things that we changed within the final version was how we defined suspension. Another piece was that we had built in within the introduced version several different exceptions to this. The first had to do with possession of a weapon. And we started from the presumption of we want to have as many pieces as possible to make sure the students were safe. But during the hearing, the advocates really made a compelling case that out-of-school suspension or expulsion is not necessarily the appropriate tool to address a situation where a pre-kindergarten student, a 3 or a 4-year-old, possesses a weapon or an illegal substance. Because in the event that you have a 3-year-old with an illegal substance, there very likely is a much larger problem at play within the household and within the family. So simply sending that student home is not actually going to get at that problem, and really that's when you need to have the different resources and abilities to, whether it be interventions or bring in child family services, to think through other ways to appropriately intervene for that child. The other piece had to do with how we defined bodily injury. The committee print changed that. The standard that was in the introduced version of the law meant that schools could not suspend or expel a pre-kindergarten student unless the bodily injury involves a substantial risk of death, extreme physical pain, protracted obvious disfigurement, or protracted loss of impairment of the function of a bodily member, organ, or mental faculty. So that was a pretty high bar. And I think as we heard more input and we had a lot of feedback from others, we realized that that was frankly a bar that was too high. And we needed to let our school leaders have a lot more flexibility. So we changed that definition pretty significantly to give that flexibility into the schools to where they can help define what that bodily injury is. We didn't want, for example, 2 3-year-olds that are just being 3-year-olds and somebody gets a scratched knee. We want to be very smart about how we use that in terms of the flexibility that a school wants to have. And finally, we want to be able to take the next step from the law that we had passed earlier, which spoke to OSSI, our state superintendent office, being able to collect data. We want to be able to collect more data on this. And so we now have another reporting requirement, which includes in-school suspensions, voluntary transfers, and that voluntary transfers, kind of when you heard Phil earlier talk about those soft suspensions of the example of saying maybe this just isn't the right place for your child, or maybe you shouldn't be here for the full day. We see that happen, and that was one of the alarm bells that we had, was around how you look at those kind of voluntary transfers. So we added in a lot more reporting requirements, as well as different categories for English language learners and at-risk students. You saw earlier the data, some of the different categories that we collected, and so we wanted to add these pieces into that. And then one of the things that was very interesting throughout the hearing was that we heard from a lot of people that the prohibition on suspensions and expulsions in 3 and 4-year-olds should almost be a no-brainer. Really, we had people starting to really advocate strongly to dramatically change, if not eliminate, suspensions and expulsions further up. We had a lot of people who advocated at least through elementary school. We had some who advocated all the way through 12th grade. So what we wanted to do as a legislative body was be able to put in these additional reporting requirements to our state superintendent's office. And what I expect to have happen is that we will use the next year or so, now that we have this policy in place for our 3 and 4-year-olds, to be able to collect the data further up and really be able to understand what is and is not happening. And I would not be surprised if we come back as our legislative body to come back and actually prohibit expulsions and suspensions for a greater number of students in a greater number of classrooms. So this really is something that probably is a first step, frankly, as we really are rethinking our expulsion and our suspension policies in the District of Columbia and our schools. So that is the information about the district's efforts and the law that we passed. I would be more than happy to answer a couple of questions here, but that's my contact information on the slide in front of you about how to contact me. I'm a member of the committee, and you can help answer a lot of questions about specifics of this legislation and how we actually got this passed, or some of the things that we learned along the way, and the process is in place. Thank you very much.
Thank you, Councilmember Allen. We did
Charles works too.
Yeah, I know. Thank you. We did get a question about the data that you were talking about the kids being more likely to be suspended who are homeless, in poverty, on welfare. Are those statistics available?
Yes, that was from our report from our state superintendent's office, and so I need you to advise me on the best way to share that, but I can either share that directly with whoever's asking, or if that's the type of report that you'd like to post online as a resource, I'd be happy to make sure we get you the link to that.
Yeah, we'll definitely put that on as a resource on our webpage. And another question that came in was, have you considered tracking expulsions at sponsored child care facilities?
I'm sorry, did you hear part of the question was the tracking expulsions from private child care facilities?
Well, it says in state-sponsored child care facilities, but I think just generally child care rather than in the pre-K settings, like maybe in a different early childhood setting.
Well, I think one of the things that we have because the district has such an expansive pre-K 3 and 4-year-old program, the 3 and 4-year-olds by and large are going to be in a publicly funded pre-K setting. As I mentioned with the numbers earlier, out of 14,000, roughly 15,000 are in that program. So this legislation, both the data tracking as well as the policies in place, would impact all of those. We do have some students who, at the age of 3, the parent decides to keep them at home. But in most cases, that pre-K 3 and 4 program is where you're going to find that child. If it's a completely private entity, if it's a completely private child care setting, the our ability to mandate some of those reports might be a little bit difficult, but that's part of what we'd look at least. Our state superintendent wouldn't necessarily be able to compel some of that reporting.
Okay. And then also, I had a question in terms of, you had mentioned to me before about how DC has a stakeholders group on this issue. And so I was just wondering if you could sort of break down like the stakeholders coming together and what they talked about.
Well, yeah, it came through through the legislative process. The stakeholders are largely the advocates, the early childhood education advocates that we certainly heard from, and frankly, they were pushing us to go much further than what we did, which was to prohibit expulsions and suspensions much later and in later grades. But we also have the stakeholders clearly from each of the LEAs. So our DCPS system, our public school system, which is the LEA, as well as our charters, and each individual charter is its own LEA. And those are clearly stakeholders in that. And then we have a large group of providers that are also a part of that kind of just early education stakeholder conversation generally. In this case, because we have had a group that has been working on a pretty regular basis, I think that that certainly helped us be able to take these steps, as well as be able to have the state superintendent have access to and really great participation in that data collection piece. And we would not have been able to move this bill forward but for having really thoughtful data that got collected first, which really helped spell out the case and really helped lay out the solutions.
Thanks. Thank you. So we have 5 minutes left in our webinar. I just wanted to remind people to put questions in the chat box. I have a few questions still that I need to ask of our speakers. But first I wanted to just briefly mention some other resources that are on our webpage. There are some other states that have done some legislative action that I wanted to mention. Maine has an ad hoc task force where they're looking at challenging behaviors. This ad hoc task force came about because of the legislature looking at this and providing a committee letter requesting it. So a link is on our webpage with that legislation. Also in Connecticut, this year they passed a law prohibiting out-of-school suspensions for preschoolers and also through grade 2. And so that legislation is also on the webpage, among other resources. And then the ones that were mentioned today, we'll make sure that we get on the web. And then I also wanted to mention that there's some federal work being done in this area. There's a joint letter and a policy statement link that we have on our webpage from the Federal Department of Education and HHS on rethinking expulsions in the early years. And some resources there as well. So check those resources out. Hopefully that'll be able to give you a good understanding of the issue and some of the things that are going on around the country. If we've missed anything, please email us and we'd be more than happy to put any legislation or any sort of work that's being done in this area in your state. So we have any other questions? Let's see, I had a question. I wanted to bring Phil back in. Phil, we have on our webpage the pyramid model resource, but I wanted to dig a little deeper into the family engagement part of it. Sure. I know that William Gormley has talked about how, if these settings are able to connect with parents in a better way, that might actually help reduce some of these concerns. So I was just wondering, in terms of the pyramid model, the family engagement piece and what it looks like.
Well, it permeates the entire model. So, when we talk about building positive relationships, that's not just about building positive relationships provider to child. It's about provider and system with family as well. And so we make a concerted effort to intimately involve families in every aspect of the pyramid. So when sites become model programs, we make sure that families are on boards. If boards haven't been established, then they need to establish one with with significant family input. We have rollout activities to orient families to what the pyramid model is all about. We have a whole support section of the pyramid called Positive Solutions for Families that are just built around the typical challenges that all families face with young children, and some very straightforward, easy to implement, culturally responsive ways that parents can really make life easier for themselves. And that Positive Solutions for Families gets rolled out in a variety of different ways. Sometimes it's one-on-one with individual families. In many cases, it's a group of families that get together around specific agenda and elements of that, if you will, scope and sequence of family support is delivered. So we wouldn't for a moment think about doing any piece of the pyramid without making sure that families were as connected as they were interested in being. And you know one of the real challenges around expulsion and suspension is the negative message that it gives to adult family members. And in many cases, for the kids that we work with, they've been in 3, 4, 5 early care and education programs per year. Yeah. And if you think about it, what's the cumulative impact of hearing your child is not welcome here, and oh, by the way, neither are you.
Right.
And so we really try to turn that on its ear and make sure that providers in our program are communicating with families about the great day that kids have when they have a great day, or the wonderful picture they drew, and just to change that equation.
Yep. Unfortunately, I have to finish our webinar, but you are so right on that. And I hope that this is the beginning of a dialogue and a conversation with our members, and we'll continue to have this conversation over the next year. So with that, I want to thank you so much, our presenters, for their thoughtful comments and presentations. Thank you, Phil. Thank you, Council Member Allen. I want to remind folks of the resources on the web. There's going to be an archived copy of this webinar available shortly. An email will be sent out once the archived version is available. Your feedback is really important to us in creating this most meaningful and beneficial program. There's going to be an online survey that's going to be emailed to you shortly. Please take a few minutes to fill out the eval. We take your feedback so seriously, and we want to hear your thoughts. I also want to just make a short plug for our Capitol Forum meeting in Washington, D.C., December 8th through the 11th. Please go online, check it out. There's still time to register. And we're also going to have a child care focus group. So if you're interested in that, please email Robin Lipkowitz of our early care and education staff. And that is it. I'm going to say goodbye. But again, thank you so much, and have a great day. Thank you.